Good day. I am Carlos Azucena from the Jose R. Reyes Memorial Medical Center, and I am going to report on a case utilizing wide-awake local anesthesia, no tourniquet, in the removal of clavicle plate and screws. Fractures of the clavicle are common, comprising 3 to 5% of all fractures, with the most common type being a midshaft fracture. Studies conducted in recent years showed that fixation of clavicle fractures provided better outcomes. To date, there have been no locally published articles documenting the use of WALANT in surgeries of the shoulder girdle. WALANT, or Wide Awake Local Anesthesia No Tourniquet, was initially popularized by Dr. Don Lalonde for hand and wrist surgery. Recent developments have allowed the expansion of WALANT for surgeries of the shoulder girdle, such as clavicle plating. Lidocaine and epinephrine are the only medications injected for anesthesia and hemostasis at the locations of dissection. Compared to general anesthesia, WALANT technique is able to achieve reduced operative time, decreased hospital stay, and decreased costs for patients. There are, however, significant risks involved with the use of WALANT, such as the inability to control intraoperative pain, which would necessitate conversion to general anesthesia. Epinephrine in the WALANT solution also carries a risk for tissue necrosis. Lidocaine is also associated with systemic toxicity when given in large doses. Presented is a case of a 52-year-old male who was already status post-ORIF with plate and screws of the left clavicle. Patient complained of palpable implant as well as limitation of ROMs. Radiographic images of the left shoulder taken on AP views revealed loosening of the implant on the left clavicle. He was then managed as a case of aseptic loosening of plate and screws clavicle left, status post-ORIF plates and screws clavicle left. Removal of the implant was done in a beach chair position. Landmarks of the operative field were drawn and injection sites were determined. WALANT solution was prepared by mixing 25 ml of 2% lidocaine with 25 ml plain NSS, 0.5 ml of 1:1000 epinephrine, and 10 ml of bicarbonate, making a total solution of 60 cc. WALANT solution was then administered using a gauge 27 needle subcutaneously along the incision site. Then, using a gauge 23 needle at 3 intervals subperiosteally. 2 cc injected vertically and 4 cc injected anteriorly and posteriorly, as seen in the figure on your right. We then used the numerical pain rating scale to assess for pain intraoperatively and postoperatively. Patient was able to do shoulder ROMs during skin preparation and draping, and a numerical pain rating score of 0 was verified before incision and checked every 15 minutes. We approached the clavicle superiorly and noted minimal bleeding. The plate and screws were then removed and skin closure was done, still with an inter-op numerical pain rating score of 0. With a numerical pain rating score of 2 hours post-operatively, and 24 hours post-operatively. 12 weeks post-op, we noted no recurrence of symptoms, able to do full shoulder ROMs, and patient was able to return to activities of daily living. In summary, WALANT technique is safe and effective for the removal of clavicle implants, is able to achieve reliable pain control, minimal bleeding, and for our case, we experienced no complications intraoperatively and postoperatively. This is my last slide. Here are my references. Thank you.